Madam Speaker, I move to suspend the rules and pass H.R. 5469, the Pursuing Equity in Mental Health Act, as amended.
We've seen suicide deaths and behaviors rising in Black children and teens in ways that we are not seeing in other groups. And as McSilver data shows, self-reported suicide attempts for Black adolescents rose by 73% between 1991 and 2017, while falling in other groups.
The Congressional Black Caucus's Emergency Task Force on Black Youth Suicide and Mental Health reiterated these points in a report last year that raised concerns about the increasing rates of suicide and mental health trends among Black children.
When I started my career over 20 years ago, we didn't really have a lot of conversations about health disparities. We didn't openly talk about marginalized communities, what their unique mental health needs were, outside of those of us who are passionate about this work, who are often people who look like me, who come from marginalized communities.
I think what we've been missing is the importance of paying greater attention to the needs of marginalized communities with respect to their mental health. I think the data has been compelling over the last few years, pointing to a particular outcome related to the rising rates of suicide among Black youth. We saw this as a ring the alarm moment and are grateful to Representative Bonnie Watson Coleman for seeing the need to form an emergency task force on Black youth suicide and mental health, charge a working group of experts who I had the privilege to lead with joining outreach efforts, and with creating a report about these trends and what to do about them. We also applaud her leadership of the Pursuing Equity in Mental Health Act of 2019.
The bill would invest resources into better understanding racial and ethnic minority mental health disparities, improve outreach and support for racial and ethnic minorities, and expand provider support for students of color entering the mental health workforce.
With the passage of this bill, what we're looking at is a complete change in how we understand, recognize, center, conceptualize, value, and appreciate what the unique mental health needs are of people of color.
This is an incredible bill that she has gotten through Congress. She authored the bill, and she also led the task force that created the bill and encouraged her to write it. The bill is looking at disparities in mental health and inequities, and leave it to Bonnie, who has been a great advocate for healthcare, for mental health, and for women and babies of color. She's been a terrific partner to me across New Jersey, and I really am looking forward to watching this bill move forward and go through the Senate.
I applaud Congressman Watson Coleman's tenacious efforts to address the rise in Black youth suicides. Her hearings, meetings, and public events have informed this legislation and shone a light on the need for more funding and research into preventing this needless tragedy. This year, America's eyes have been opened to the effects of systemic racism and health disparities on communities of color.
The question is, will the House suspend the rules and pass H.R. 5469 as amended? Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. The bill is passed. Without objection, the motion to reconsider is laid on the table.